Hello everyone, I'm going to representing my video presentation on the topic of aging. The first one, impact of aging on the mental health and well-being on older people. The first one, I'm going to explain the definition. What is aging? Aging results from the impact of the accumulation of a wide variety of molecular and cellular damage over time. This can lead to gradual decrease in physical and mental health capacity and growing risk of diseases and ultimately death. According to World Health Organization, in second slide, I'm going to explain the potential impacts of aging. The first one is increased risk of depression and anxiety, cognitive decline. The third one is loneliness and social isolation. When people get aged, they feel lonely and get separated from the society. Fourth one is physical health challenges. When the patient get old, they have lots of physical health challenges like they are not enough strong to do their daily living activity. Second one, this next one is financial concerns, changes in living situations, loss of independence. The last one is impacts of COVID-19. We already know when the COVID-19 pandemic was occurred, they have lots of challenges in their lives. They have to get help from the other uh, health provider like carer, personal care support worker, their family members, because they are not have strong immunity or strong physical health to fight against their situations which are negatively impact on their health. In slide third, I'm going to explaining nurses work in collaboration with older people experiencing common mental health disorder. The first one, person-centered approach. Person-centered care has long association with nursing. Nurses have to focus on how to treating older people as individuals, respecting their rights as a person, build mutual understanding between them, and developing therapeutic relationship with older people. The second one is holistic care plan. Nurses can collect data from patients, family, and colleagues to develop individualized care plan that address their mental health needs like physical, environmental, and social needs so they can provide good health care to the older people. The third one is medication management. Nurses can monitor the effectiveness and the side effect of psychotropic medication so they can treat well and provide good health response to older people. The fourth one is promotion of recovery and resilience. Nurses promote recovery oriented care by fostering hope, resilience, and self-empowerment in older people with mental health disorders. Nurses can encourage older people to participate in daily living activities that will enhance their well-being, social connection, and support meaningful engagement in their life. The last one is crisis intervention. Nurses are well trained to recognize signs of suicidal ideation or behavior or and implement appropriate interventions to ensure the safety of all the people. This may include monthly risk assessment, safety plan, referral to emergency services, and crisis hotline check. So these are the points for nurses how to work with the older people who have mental health disorder. In next slide, I'm going to explain the supporting experiencing of mental health illness and their family and the carer, how to promote the empowerment and the support to older people. So first one is psychotropic medication and psychotherapeutic interventions are effective for older people experiencing mental health problems, and many studies shows that psychotropic psychotherapy with older people promotes an improvement in depression and increase general psychological well-being. The second one is dignity of life, helpful adaptation to change in the quality of life. The third one is we also have a guts to say no to ageism to and using principled person-centered care and treating everyone with respect and dignity. We could consider that how International Council of Nurses Code of Ethics could be applied, and it states inherent in nursing is a respect for human rights, including cultural rights, rights to life, choice, to dignity, and be treated with respect. Nursing care is respectful and unrestricted by considerations of age, color, disability, or illness, sexual orientation, nationality, politics, race, and social status. So these are the points how we empower and how we promote effective ways to enhance the well-being of older people. With this point, we can enhance the good well-being of older people. In next slides, I'm going to explain the strategies how to promote mental health in older people. First one, I'm going to explain mental health promotion and prevention strategies for older people, focusing on healthy aging. That means creating physical and social environment that support well-being and enable people to do what is important to them despite losing in capacity. Measures to reduce financial insecurity and income inequality. Promote to ensure safe, accessible housing, public building, and transport. Support for older adults and their carer. Support for healthy behavior, especially to eat balanced diet, be physical active, refrain from tobacco, reduce alcohol use. Last, health and social programs targeted at vulnerable groups such as those who alone and in remote area and those living with chronic mental health illness. These are the strategies to promote mental health in older people. In last slide, I'm going to explain the programs and the tools to support government response to mental health needs of older adults. The first one is the Decade of Healthy Aging is a global collaboration which led by WHO to improve the lives of older people, their families, and the community in which they live. The second one is Comprehensive Mental Health Action Plan, which is support improve mental health and mental health care for all population, including older adults. The third one is Mental Health Action Program, which provide evidence-based clinical protocols for assessing, managing, and following up a set of priority mental, neurological, substance use conditions in non-specialized settings, including depression and dementia. The Mental Health Gap Action Program intervention guide include clinical tips for working with older adults. So these are my video presentation. Hope you all guys like it. Thank you for listening my video presentation.